Commissioning support organisations are focused on helping commissioners achieve the highest quality and most cost-effective healthcare outcomes across the NHS. The multi-award-winning team at North of England Commissioning Support has developed high-quality, innovative tools and services to help deliver new models of care. Sue Saville reports.
As the NHS faces its biggest financial crisis in a generation, according to the health regulator Monitor, a radical change is needed in the way services are provided. But bringing health and social care together is a huge challenge, says the head of North of England Commissioning Support, or NECS.
The transformation before us is probably the most significant that any of us have seen since the inception of the NHS. We don't have a system that is sustainable in its current format. So we need to redesign our system such that we have less need of acute care in an acute hospital setting, and more of our needs are satisfied either at home or in a community setting where most of us would rather be.
It's in the community setting that NECS is harnessing technology to help maximise limited resources.
I can look at the kind of problems that people have been coded with.
This is NECS' healthcare intelligence tool known as Radar. Developed with GPs, it provides a single portal bringing together the wealth of NHS data to identify at-risk patients.
Radar helps to work out, using all the data, the probability or the chance of one of my patients being admitted to hospital in the next 6 months. So I use the data that I get from Radar to invite people to come in, and I spend much more time with them and work with them to try and keep them well, keep them happy and in the community rather than unhealthy and in hospital.
As well as designing their own tools, NECS also use other systems like Mosaic, developed by credit ratings analysts.
What they do is they take a number of factors about a population and process those and then give you a profile about the people that you serve. If we're looking at bringing a new intervention into an area, we can look at the demographic profile and also the patient needs from their health profile to the software and see whether it is something we genuinely need in that area.
Targeting resources is the team's priority.
By concentrating specialist services in fewer locations, in fully staffed units that are well trained and well supported, we will improve the outcomes for patients. Also, we're looking to move as many services as possible to local locations as opposed to in more centralised ones.
With the demands of an increasing and ageing population and the need to make some £20 billion of savings in the NHS, new ways are being found to make efficiencies. Here, technical analysis is being combined with practical stakeholder workshops to help commissioners set their budget priorities.
What is the benefit of providing an intervention?
These workshops, bringing commissioners, clinicians and patients together, are part of the STAR model, socio-technical allocation of resources, to build consensus on which services work best. Here, looking at respiratory conditions.
One of the things we're hoping as outcomes from these is it opens the dialogue. I think that's one of the things we often struggle with, especially when there's scarce resources, is how you maintain that dialogue and how you take it forward. And one of the things we've learned running these sessions is it very much opens that dialogue.
It opens your eyes up to see what possibilities are available and the decisions that can be made that can overall help the benefit people with COPD.
Engaging with the most vulnerable patients can help close health inequality gaps. NECS reaches out to them via a tool called My NHS.
Once we have identified and understood who they are and what their needs are and what their lifestyles are like and what their issues might be, we can target them directly. It comes in extremely useful for engagement around transformation because we can use it to seek targeted feedback.
Pioneering its own tools and working with proven systems, NECS aims to deliver efficiencies to ensure that patients get the services they need.